South Africa is home to the largest HIV epidemic in the world. COVID-19 has had a devastating impact on the healthcare system, with already limited resources being stretched to deal with the new pandemic. Such impact includes provinces not reaching their testing targets or targets to roll out the HIV prevention pill. These problems are coupled with the harsh living and social conditions of many South Africans due to continuing high employment and poverty. This video highlights the problems facing key and vulnerable population in accessing healthcare services, the rights framework guaranteeing health rights, and how legal practitioners can advise their clients. Key and vulnerable population often face discrimination when accessing healthcare services. Some examples include prejudice from healthcare workers regarding their lifestyle, whether it is sexual orientation, gender identity, or drug use, as well as breaches of confidentiality when healthcare workers are unnecessarily disclosing a patient's HIV status. There are reports that HIV patients are routinely separated from general patients with color coding or separate queues. Then there are also problems with accessing healthcare services. There are routine complaints about the unprofessional conduct of clinic staff who lack empathy, long clinic waiting time, and lost patient files. Other problems include limited clinics in rural areas, poor nutrition programs, and the lack of counseling services. These all result in high rates of people lost in the treatment and reluctance to seek care. Due to these human rights violations, key and vulnerable populations remain key and vulnerable. It can be urged that the key and vulnerable population have become accustomed to being treated badly and that this is nothing new. However, South Africa's strong constitution framework guarantees health rights for all. The Constitution guarantees that everyone has the right to have access to healthcare services, including reproductive health care. Further, the right is qualified in that the state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of each of these rights. This qualifies on the rights to health and other socio-economic rights, has resulted in the courts not giving content to the right and confining their role to assessing whether the state has taken reasonable legislative and other measures to implement the rights. In respect of children, every child has a right to basic healthcare services. Despite the right not being qualified, the court has interpreted the right in the context of other socio-economic rights, and therefore the interpretation is that the rights of children are also qualified. The National Healthcare Act seeks to regulate national health and provide uniformity in respect of healthcare service, and highlight the rights and duties of healthcare providers and users, and also provides to a compliance mechanism. In respect of private healthcare, the Medical Schemes Act provides that persons living with HIV/AIDS cannot be excluded from membership, and every scheme must provide prescribed minimum benefits for people living with HIV/AIDS, such as medicine, voluntary counseling, and screening. What can pro bono legal practitioners do? The task at hand seems insurmountable. However, the journey of 1,000 miles begins with one step. Understand and listen to clients. Key and vulnerable persons are more likely to have suffered human rights violations, and they need representation that is free from discrimination. As a legal practitioner, take some time to understand and become comfortable with your client's circumstances. There have been a limited number of cases in which the right of access to healthcare services has been invoked. As a result, there is a relative scarcity of judicial authority, especially on the interpretation of children's rights to health care. Legal practitioners could undertake more cases on the rights of the health, particularly children's rights to health care, and create a culture of enforcement of the rights. Use other complaints mechanisms, such as complaints procedures set up with healthcare establishments, the South African Human Rights Commission, and the Public Protector. Get involved in legal education programs. Assist civil society organizations in educating activists, paralegal, and staff on the law. Pro Bono will post more videos in the future as well as hosting live webinars. Please remember to click like and follow us for more videos and webinars to keep you informed. Visit probono.org's website for useful resources to help you with your work. Feel free to comment on how you wish to get involved with probono.org's work or how we can better help you.